This is Bishop Edward Weisenburger once again. I'm back with Dr. Anna Sanguineti, who is kind of my medical expert, the one I turn to with questions about life issues. She's extremely helpful to us and to the pastors of our diocese. The last time you were here, Dr. Sanguineti, you began to talk about different facets of abortion, and we got to the point of discussing chemical abortions. And I asked you to come back, and I'm so grateful that you did. I keep reading about this. I keep hearing about it on the news. What are the basic points we need to know about chemical abortions?
Thank you, Bishop Weisenburger, for having me back. Yes, I did want to talk about chemical abortions because they are in the news. They have, over the past several years, gained in popularity, and actually now they account for over 50% of all abortions in the United States, specifically the ones that occur in the first trimester. But another point about them is that the abortion industry has been promoting chemical abortions as a safe alternative to surgical abortions. And
are they safe?
Are they safe? Well, let's go through that. Let's talk about what these pills are. So the chemical regimen, first of all, I call them chemicals, not medications, because medications are prescribed to improve the health of someone.
They're part of health care.
Right. And in this case, these two pills cause the death of an infant, and they cause significant pain to the woman who's taking them. So they're actually quite toxic, and that comes with the chemicals themselves. So you have two chemicals. The first one is called mifepristone, and mifepristone is an anti-progestin drug that blocks progesterone. The reason I tell you this is because progesterone is necessary for the health and the development of the baby in the first few weeks of life. The use of that medication first can cause the death of infants in the womb about up to 72% of the time. And so it is a significant amount.
What about the other 28?
Exactly. That's good math, Bishop. There are 28% that can survive that first pill. And
the baby survives that first pill?
Yes, and so 24 to 48 hours later, a second pill is taken, and that's called misoprostol. And misoprostol is a drug that originally came out for another use, but it was quickly found to induce preterm labor. And so someone came up with the idea to combine it with the first drug and use it as an effective abortion regimen. With the second drug, then the efficacy or the efficiency of both causing the death to the infant and expelling the contents of the pregnancy is about 92%. So it's more significant. However, it does...
There's still 8, if my math is correct.
Yes,
8%.
That's true. That's true. But, I mean, it is quite significant.
Right. What happens to those 8%, though?
The 8%, typically, if the woman realizes that she hasn't had an abortion, or if she's had an incomplete abortion, then she's going to have to return to the doctor's office. And in the abortion clinic, they would have to follow up either with another pill, a second pill again, repeating it, or a surgical procedure. So, you know, clearly with the intent to cause an abortion, you're going to proceed.
Because when I see this on the
course.
news, it almost looks like it's taking an aspirin. It all sounds so simple and clean, and it just sounds to me like there's a lot more to this.
There is a lot more to it. The abortion industry would have you believe that taking 2 pills is so easy, and it does appear to be on the surface less gruesome. Of course, you don't have a procedure, and it's easier to deny the reality of what you're actually doing. But an abortion is an abortion, no matter the method. The thing is also is that it's easier to avoid reporting side effects on from the viewpoint of the medical clinic, and it is easier to evade any of the restrictions that are placed on the drugs because of the fact that you can get them through the mail or you're giving them out in the office. So there aren't real, it's harder to follow and track. that becomes a problem. But let me tell you about the side effects, because you asked, are they really safe?
It's still my question is the safety of this.
Yeah, I could not say that these are safe drugs, and it's surprising that they were ever approved in the first place, except for the fact that they accomplished their intention, which is to cause the death of the infant. So the most common side effect is going to be bleeding. But bleeding can rapidly progress to heavy bleeding or even hemorrhaging in some cases that necessitate a visit to the emergency room. And actually, the data has shown that up to 30% of patients or women that take these drugs end up with at least one follow-up emergency room visit.
3 out of 10?
Yes.
Oh, my Lord.
It's
okay.
a third of them, roughly a third.
You don't hear this on the news.
No, you don't hear this, but, and the data is not very concise or clear because a lot of this isn't reported, but we do get a lot of reporting from the Guttmacher Institute, which is a pro-abortion institute that tracks some of this. It's hard to track because, again, like I say, it's a very private thing that is happening. A second side effect, of course, is nausea and vomiting, ever present. I think a more important side effect and something that you can expect is that you have abdominal pain, and in some cases can be quite severe, but in over 90% of women taking this regimen, these 2 pills, and uterine contractions, because of course that's necessary to expel the products of conception. You have the intense pain. You also have fever and infections. Infections can occur if you have an incomplete abortion and some of the products of the pregnancy are left inside the womb. And in very rare cases, infections can lead to death. But I think something that's also good to note, or important to note, is that a ruptured ectopic pregnancy can mimic those same symptoms. You can have those same symptoms. So if someone is trying to have an abortion, taking these pills, and she develops these
and she might think these are just normal side effects, and they're not.
Exactly, and they're not. They may actually mean something more significant, that she has an ectopic pregnancy, which, as we know, can pose a real risk to the life of the woman.
Yeah. Are there any safeguards in place, I mean, medically or through the industry or through the FDA or anybody like that?
Well, when this first came out in the early 2000s, the FDA did have some safeguards. And in 2011, they developed REMS, which is a risk evaluation and mitigation strategy. And that name just means that they put some guidelines in place for the doctors or the medical personnel that were going to be prescribing these pills. The first thing was they required 3 visits to a clinic, the pill after an evaluation by a physician and an exam by the physician, then could prescribe these 2 pills, and they restricted its use to 7 weeks after 7 weeks of gestation, which would be after the last menstrual period of the woman. That would result in 92% effectiveness in causing the death of the baby. There was no requirement to have ultrasounds. There was a requirement to report side effects at that time. But in 2016, these guidelines were very much watered down with pressure from the abortion industry. No longer was it a requirement that you have to see a doctor. So it could be any healthcare professional, typically a physician assistant or a nurse practitioner. Secondly, they eliminated the requirement to have 3 visits at the clinic. First, they eliminated 2 of them so that you only needed 1 visit, and then during COVID, they used that as a pretext to eliminate all visits, and now you just have a telephone conversation with someone at the other end taking your information. There's no exam and there's no confirmation of your pregnancy, either through a pregnancy test or through an ultrasound. And you're relying on the history of the woman who can have an inaccurate history. Also, you're hoping that the person will ask, are there any contraindications, such as if a woman is taking blood thinners, then this is the last drug you want to give them since it can produce bleeding, and in this case it would be more severe bleeding. They also eliminated the need to report side effects except in the case of death being a rare event from this. So overall, basically what they did was by watering down all of these requirements, they really increased the risk to the woman with her health care. Yeah. Because a doctor in an exam would be able to tell or would have a suspicion if there's an ectopic pregnancy, and he would perform an ultrasound if he thought that it was needed.
He or she.
So yeah, so the safeguards that had been in place were essentially removed. And then more recently, they're allowing pharmacies to dispense these chemicals. So it's going to be more widespread in its use.
In a very few minutes, you've just told us a lot of information. Doctor, the last time we spoke, we talked about how abortion really isn't healthcare. Healthcare is making people better. And so this isn't a matter of healthcare, but it seems to have so many risks and harm to women. And even in my years as a parish priest and as a bishop, I've seen so many women come to the church who felt so profoundly damaged by abortion. Do you really see this as a pro-woman thing, the way it's presented in the media?
Right. It would be hard to say that the policy of abortion on demand is pro-woman because, first of all, just wrenching the body of a new life out of a woman's womb is not only not healthy, but it isn't to her benefit at all. And there's so many alternatives to just saying the easy fix for a pregnancy is to kill the baby. And the Catholic Church provides a very beautiful alternative in walking with that woman and helping her. But you know, other organizations have also found that this is dangerous and it puts a woman's health at risk.
I must say it surprises me a little bit that as litigious as our society is, that there aren't any lawsuits or anything about this.
Recently, actually, a lawsuit was filed by the Alliance Defending Freedom and the ADF. They filed a lawsuit against the FDA and against the current administration. The purpose of this lawsuit is to demand accountability and to demand that the FDA assess and evaluate all of the side effects, the adverse effects that are occurring, what is the actual incidence of this, and how is this either helping women or putting women at risk with the side effects. And I think, as we talked about, the side effects are significant. So I think it's good to have a lawsuit out there that demands more accountability from the FDA as far as what women are facing when they take
might make
these
some
drugs.
of that information a little bit more transparent for all of us, and put it in the public sector too.
Right.
Well, thank you so much. That really helps to understand that. It's very troubling to me to hear all this, but I sure do appreciate the clarity of understanding of.
I worry about it because, frankly, I don't like to put toxic substances in my body, and as the mother of a daughter, you know, it bothers me that a woman is being treated so cavalierly. Yeah. You know, you have to worry. You know, my takeaway point from all this, several takeaway points, is one that abortions can harm women, and these chemical abortions do harm women. And whether that's physical or medical that you see, it can also be emotional and spiritual. I think that is the big thing. Yeah. And you have a scenario where you have a woman that is prescribed these pills and then takes them home. She's home, she's alone, she's scared, and she's vulnerable. And at that time, she's experiencing all of these sensations, you know, having the pain and having the bleeding. I think it's a really scary scenario for someone, and I wouldn't as a physician and as a mother, as a human being, I wouldn't want to put someone else in that situation, you know.
Doctor, that is so clear. I'm really very grateful to you. You know, the problem is when you give us this information is it makes me always want you to come back and deal with my next topic that I need your expertise on. So will you promise to come back one more time maybe, or two more
I would
times, or
love
10
to
more
come back.
times? You're always so kind, but I do hope that you'll come back because we have many more questions.
Thank you.
Well, thank you so much.
Thank you,
God
Bishop.
bless you.
I appreciate it.
You bet.